Hello, I'm Meryl Comer, longtime advocate and a founding board member of Us Against Alzheimer's. Welcome to day 2 of our National Alzheimer's Summit. If you missed any of the first day events, all of the sessions are available to watch on demand on our website, UsAgainstAlzheimer's.org. In case you missed last night's gala, in honor of our co-founder, Trish Bradenberg, who brought all her talents as playwright, author, and her smart humor as a comedy TV writer to our tireless fight against Alzheimer's. Together with her husband, our founder and chairman, George Bradenberg, they were an unbeatable team, and her spirit lives on. At the gala, emceed on the West Coast by TV personality Lisa Gibbons, celebrity advocates like Seth and Lauren Rogen, who founded Hilarity for Charity, neurologist Lisa Genova, author of Still Alice, Josh Henkin, his book, Morningside Heights, and Patty Davis, former President Reagan's daughter and author of the new book, Floating in the Deep End, shared the power of their voices and commitment to our cause. Here are some highlights.
When my mom Adele was diagnosed with Alzheimer's when she was 55, Seth and I were just 25 years old. We never expected at that point in our lives to be managing the devastating decline of a parent.
So we did what we knew best. We turned to comedy and entertainment to bring light to Alzheimer's for young caregivers like us who needed support.
We also set out to share what we've learned about brain health in interesting and fun ways.
I took on my alter ego as Professor Seth Rogen, and I created coursework which teaches young people that Alzheimer's actually begins in the brain up to 20 to 30 years before the onset of symptoms, and there is no better time than now to start building a more Alzheimer's resistant brain.
My grounding for my experience with my father that ended up being 10 years was my belief that his soul could not have Alzheimer's. And that enabled me to look beyond the disease, to look through the disease, not in the sense of denial, not ignoring the symptoms that were there or refusing to deal with the symptoms that were there. You can do both. You can deal with the disease, you can deal with the cognitive decline and all of the difficulties that come up, and still remember that there is a soul in there. There is a human being in there that I don't believe Alzheimer's can touch. And that human being still remembers that they love you.
I know that the combination of commitment and dollars is really our best hope for ending the disease and ending the stigma around the disease. And I'm also really heartened by the way the arts community is getting behind the kinds of enterprises that your organization is engaged in to support research and education and other things that are so essential to the Alzheimer's fight. So mostly I just want to say thank you.
It's not just enough to know something about Alzheimer's. I know you all know something about Alzheimer's. You've got to feel something about Alzheimer's. And to feel something about Alzheimer's, you have to know someone who has it, or you have to know a story. And so for you all out there who know Alzheimer's, who feel something about Alzheimer's, tell your stories. This is how we're going to get more and more people to care about this disease, to really feel something about it. And the more people who care about this disease, who make it a priority, the more we're going to see collaborations, a galvanized world committed to ending this disease. This isn't false hope. This isn't Pollyanna rose-colored glasses. I've been in this game for a while, and this is the most exciting, most hopeful moment we've seen in a very real way. And I'm texting with George Bradenberg yesterday, and he's sending me what you all are up to with respect to gathering the world's most badass researchers, resources, minds across the globe to kick this disease's ass. We can do this. We can do this, and we have to.
At last night's gala, we also offered a tribute to Marilyn Glosserman, our board member, who championed our focus on brain health as she bravely fought her own losing battle with cancer. Her positive spirit and tenacity will continue to inspire us all. Us Against Alzheimer's is advocating to make brain health a national prevention goal. And it's certainly top of mind for all of us 50 plus. It's about being smart and taking action to reduce the risk of cognitive decline as we age. Let's hear now from Dr. Mark Hyman and other brain health champions.
Hi, I'm Dr. Mark Hyman, and I'm really thrilled to be with you all on this very special occasion. I'm an expert in functional medicine, which is the science of creating health with a holistic, person-centered approach. And I'm really proud to introduce the next program priority, which is the early intervention and prevention of Alzheimer's disease. When the team at Us Against Alzheimer's invited me to introduce this topic, I jumped at the chance for 3 reasons. First, I've long believed that prevention is possible, but we have to empower people to understand the role of nutrition, exercise, sleep, stress reduction, and other factors. As I often tell people, food isn't like medicine, it actually is medicine. Second, I've been so inspired by the work that Us Against Alzheimer's is leading in the area of brain health and risk reduction. Your team is making progress at every level, driving clinical practice and improved education for providers, promoting brain health challenges with consumers, and engaging in policy work to make prevention a national priority. And third, I'm pleased to work with many incredible people who've made this progress possible. One of these leaders is Marilyn Glosserman, who was a board member at Us Against Alzheimer's. I'm here tonight because of Marilyn. She first introduced me to Us Against Alzheimer's, and I think she actually may have been one of the first people to sign up for my newsletter and writings about brain health. For more than 5 years, Marilyn was a tireless support of brain health. Before it was in vogue, she was advancing and advocating to anyone who would listen. And I have it on good authority that it was Marilyn who championed brain health within Us Against Alzheimer's. She stepped up and worked with leadership to bring this program to fruition. Please join me in honoring Marilyn for this dedication. Her impact can be felt by hundreds of thousands of people. Now let's see how Us Against Alzheimer's is putting Marilyn's inspiration into action.
When it comes to brain health and healthy aging, these things aren't just things that happen to us. These are aspects that we can take action in, cooking healthier foods, spending time outside, volunteering, working, whatever it may be. These can all be a part of how we approach brain health and healthy aging. And it serves to change policymakers' views about how they think about aging, away from dementia is inevitable to there are things I can do.
We have to all work together on our chronic diseases because this nation has never invested in prevention. If we don't invest in prevention for every one of these chronic diseases and lifestyle health, we're not going to improve the outcomes for these chronic diseases, and we're not going to prevent dementia and Alzheimer's.
I want to know everything I can do to prevent having dementia for me and other of my loved ones. And through this big platform of Us Against Alzheimer's, we're able to share all the information that we gain. We are working really hard and appreciate the collaboration of Us Against Alzheimer's, especially in the role of the prevention goal, which is very exciting. We must invest in prevention if we're really going to cure Alzheimer's disease. Alzheimer's disease will bankrupt our country in terms of Medicare and Medicaid costs, and this is true globally. So it's so important for us to work on prevention goals.
We want to work to empower people. We want them to live healthier, happier, more connected lives. And I know that Us Against Alzheimer's wants to do that, and so does Silver Sneakers. And we love that can-do kind of bias for execution and changing policy, advancing innovation in ways that can really help our sick care system move into a true healthcare system.
Us Against Alzheimer's Brain Guide is one more way we empower people to privately test their own memory and then receive online and customized resources. Here's how it works and why more than 150,000 people have used it for themselves or a loved one.
Are you worried about your memory and brain health? Do you have concerns about a loved one? Us Against Alzheimer's can help. Brain Guide is a free platform that provides you with knowledge and resources to take the best next steps in managing your own or a loved one's brain health. Brain Guide includes confidential memory questionnaires that can be taken over the phone or online in English or Spanish. If you have memory concerns for yourself or are noticing changes to your thinking or memory, you can take a self-administered questionnaire. If you have concerns about a loved one's memory, you can take a questionnaire for someone in your life that you see often. When you are done, we send you tailored resources based on the answers you gave us, and you have the option to print a summary for your doctor. Brain Guide is not intended to diagnose or make treatment recommendations regarding Alzheimer's or any other disease. First steps can be tough, but just one small step now can help you take every step that follows with confidence. Visit mybrainguide.org or call 855-BRAIN-411 to learn more.
Brain Guide is about empowerment, fairness, and healthcare equity, making medical information accessible in as many ways as possible and to as many people as possible. By making this platform free, we remove the cost barrier for underserved communities. By making this platform accessible through both an internet and phone connection, we're getting critical information to disenfranchised communities. And we know access is just as important as improving healthcare as cost and quality.
Early detection will be key in the future to addressing the rising incidence of Alzheimer's disease in Latino populations and other communities of color. Brain Guide is an easy-to-use tool available in both English and Spanish. As a result, I think it really will make a difference in placing resources at the hands of patients and their families to take the first step in learning about their own memory health.
The key to diagnosing or to treating Alzheimer's disease, in my personal opinion, is early diagnosis. The longer you wait with the question of whether or not you have Alzheimer's disease or any kind of a memory problem or dementia, the harder it will be to manage that disease. And the way to do that is to be able to figure out, what is going on and what do you do next. And that's what Brain Guide does. It gives you something actually in your hand, if you choose to print it, to actually bring to your physician, because the key is to not delay your evaluation.
I was diagnosed in 2014 with early onset Alzheimer's. I am the third generation in my family with Alzheimer's. My mom died 4 years ago with it, and my aunt died 5 years ago. I wish I had had Brain Guide back when I was being diagnosed, because I was having problems and couldn't quite understand what it was. I wanted to contribute it to just getting old, but when I look at the Brain Guide questionnaire, it really specifically addresses where you are in your journey. It's very helpful to have that to give to your neurologist or your doctor, and then you can proceed on to find ways of coping and dealing with it.
I believe Brain Guide is a phenomenal resource. It just has everything in one place. I love that. You can get information about what to expect along the journey, and that's so helpful for caregivers.
At last night's gala, I had the honor to interview Dr. David Satcher, former U.S. Surgeon General and recipient of this year's B. Lerner Valor Award, named after Trish's mother. Dr. Satcher will be featured later today at our summit. A deep commitment to health equity is a foundational pillar for Us Against Alzheimer's and has guided our advocacy since the beginning. We believe it's part of our DNA. We knew that those most impacted by Alzheimer's needed the biggest voice and the most support. USA2's networks, Women Against Alzheimer's, African Americans Against Alzheimer's, and Latinos Against Alzheimer's have advocated for these communities ever since. Here are their voices.
Thank you, Us Against Alzheimer's, for your consistent inclusion and consideration of nurses in the main pillars of your work and initiatives focused on early intervention, health equity, and access that is particularly important for historically marginalized communities. The Center for Brain Health Equity reflects our organization's long-term commitment and mission to improve the health of Latinos throughout the country.
It's important to recognize different voices from different communities in our fight against brain diseases. Just as we have seen over the past year from the impact of COVID-19, Alzheimer's is a disease that disproportionately affects women and people of color. 65% of Alzheimer's patients are women. And by 2030, less than 10 years from now, 40% of Americans living with Alzheimer's will be Latino or African American. We have to change this.
The National Black Nurses Association has over 200,000 professional nurses, LPNs, and nursing students, and really advocates for the African American community and healthcare disparities. And the partnership between the two of us has been phenomenal. Together, we can have an empowered voice to really change things.
We're serving 24 Latino caregivers with text messages to help them care for themselves and their loved ones. And the other one, we've been able to train 59 primary care providers in how to serve Latino families with dementia.
AARP is pleased to partner with Us Against Alzheimer's as we both advocate for equitable care policies that cover and support not just those living with Alzheimer's and other related dementias, but their family caregivers. It is critical that care policies such as paid family leave are enacted to better support these family caregivers that, given no other opportunity, may end up having to choose between caring for the person that they love or their job.
Us Against Alzheimer's has helped to drive impact in our local community based on their innovation and support. This partnership is, I call it a movement in that there is always an ongoing effort to make sure that these communities are served in excellence.
Another of our guiding principles since we launched in 2010 has been to give voice to those living with Alzheimer's and related dementias and their caregivers. Their needs, their perspectives drive the work that we do every day. We all have stories to tell, but the power lies into turning those personal experiences into what we like to call data with soul. Our AD PACE program conducts pre-competitive qualitative and quantitative research on what outcomes matter most to patients and caregivers to ensure that the voices of Alzheimer's are heard by government, policymakers, regulators, and the pharmaceutical companies. Through Us Against Alzheimer's A-List, an engaged, research-ready online community of close to 10,000 people living or caring with someone with Alzheimer's, as well as healthy adults interested in brain health, we take the pulse of the greater Alzheimer's community and share back the results in a timely way that validates and reinforces no family is alone in their journey. Let's hear more about how you can join the A-List and share what matters most.
The A-List is valuable to research, to my research, because I believe that researching the authentic voice of the person living with dementia and the caregiver, care partner, is really powerful in understanding any burden that is experienced and understanding what the needs are and how to address issues that they may face. We cannot give best care without understanding that, especially without understanding the unique needs of a diverse population. And the A-List is doing this. This is why I will continue to partner with the A-List so the voice of my community will be heard.
I'm Jerry Taylor, and I'm living with Alzheimer's.
Hi, I'm Jim Taylor, and I'm Jerry's husband and care partner. We're not clinicians or physicians, but we believe that it's important that every voice be heard in the fight against Alzheimer's. We're particularly happy to participate in A-List surveys because the surveys deal with questions that are important and vital to us, including COVID's impact on caregiving and what are the restraints to participating in clinical trials. These are all issues that Jerry and I are very much concerned about, and we're very grateful to have A-List helping us deal with these issues.
Hello, my name is Martha Villanegro Santiago, and I'm a care provider for my mother living with Alzheimer's. Being a part of the A-List, I feel empowered knowing that my opinions are being heard by Alzheimer's researchers and policymakers. The A-List gives increased purpose and meaning to my journey.
I was a caregiver for my mother, who just passed from her battle with Alzheimer's last year in October. The A-List has contributed to a growing body of research on the lived experience and what matters most to people like me and you, people who are living with dementia and or caring for a loved one. Seeing how this research is making a difference and how my personal experience is translated into research inspired me to fund the A-List program and to further its impact. In celebration of the 5-year anniversary and the work to be done in the next 5 years, please join me in supporting the Us Against Alzheimer's A-List. Thank you so much.
To join, go to alist4research.org. And now it's officially summit time, coming up at 1:30 p.m. Eastern. A panel on the power and potential of technology and precision data through tailored prevention, improved detection, diagnosis, and treatments to advance our fight to end Alzheimer's. We'll also cover how to ensure that these technologies and their benefits are accessible to everyone who needs them. Then at 2:30, we are honored to welcome 2 former U.S. Surgeon Generals, Dr. David Satcher, also a USA2 board member, and Dr. Jocelyn Elders for a timely discussion about how to make Alzheimer's prevention and brain health equity a reality for communities of color. Thank you again for being part of our summit and joining us today.